My name is Will Perry. I'm a vascular surgeon here at the Longstreet Clinic in Gainesville, Georgia. I'm born and raised here in Georgia, Cumming, Georgia. Both my wife and myself are. Went to high school here and then went to the University of Georgia for my undergrad, and then stayed also here for my medical school training at Medical College of Georgia in Augusta, Georgia. When I decided to go into vascular surgery, I then was able to go up to Cleveland, Ohio at Cleveland Clinic, where I did all of my vascular surgical training. My wife and I, we have 4 kids now. So when we were looking at places, we really wanted to come back, to home and to where we were from. So that's how we ended up in Gainesville, Georgia. Also, I had a goal of wanting to provide care for, the community that I came from. So our group and our department is able to treat, all vascular type of disease processes, anywhere from your routine to your most complex, provide a good variety and breadth of procedures. Myself, I tend to focus on carotid occlusive disease, so narrowing or blockages in the carotid arteries in the neck that can lead to strokes. I also focus on aneurysmal disease, both complex open reconstruction and endovascular reconstruction. And then thoracic outlet syndrome, which is compression of the arteries and the nerves that go to our arms. So I chose medicine because I like working with my hands. Growing up, my dad was in construction, so it was always building stuff with him. I got into vascular surgery mainly because when I was a medical student, I rotated through a vascular surgery department and really fell in love with just the overall care of the patients, the type of surgeries that we do, as well as the other staff members that were in the department. My overall goal, for when I see a patient is just to allow them to tell me, kind of what's going on, what the big issues are, to kind of allow them to speak for themselves and to hear their story. And then I just want to provide an overall comprehensive care for, their vascular needs and somewhat act as a primary care physician for, their vascular needs. So if I'm not at work, I'm typically at home with, my family. It's pretty busy and chaotic at home with 4 kids. We live on a farm, so we take care of a lot of that stuff. And then in regards to hobby, I do a lot of hunting and fishing with my kids.